My name is Barbara Clark, and I'm a registered nurse and a nurse practitioner. I'm currently not working. I used to work for the San Joaquin Community Hospital in Bakersfield, California, which is part of the Adventist Health System. And I was injured on the job there February 16th, 1994.
And what happened after you were injured?
After I was injured, what basically happened is I was assisting a doctor in labor and delivery during the delivery of an infant, and the woman in labor kicked me in the left side of my head. And because the delivery room was so little, my head struck the backside of my head struck a concrete wall, and I was extremely dazed, and they took me to the emergency room at the hospital that night. In the emergency room, the doctor that saw me, as it later turned out, wasn't even an emergency room doctor. He was actually family practice. And they did a quick x-ray and said that basically there was nothing wrong, sent me that same night, although I was complaining that I was sick and wasn't feeling good and had a headache. They sent me to an industrial doctor about 2 blocks down the street. I had to go down there and meet the doctor with the x-rays. And the doctor never really did an exam. He just held the x-rays up to the light and said, you just have a contusion to the cheek, take some Tylenol and go on back to work. I ended up not being able to work that night anymore. I used to work the night shift. So I ended up going home, and the next day while I was brushing my teeth, some of my teeth fell out, and I still had an excruciating headache. And at that point I realized that there was something really wrong going on. I called my supervisor and I explained to her that I needed to see a dentist, that these teeth had fallen out, and from then on it's just been a constant struggle. I've been accused of causing the injury myself, that someone else had done the injury to me, that nothing had really happened that night. And at one point...
you filed workers' comp claim?
I did. I filled out, before I even went into the emergency room, I had to fill out a work comp form in the supervisor's office. And that was immediately filled out, probably within the hour of the accident happening. So the work comp paperwork was filed immediately. There was no dispute that there were witnesses in the room. There was no dispute that this accident had happened.
How did it happen? What happened?
Basically, like I just said, is that this woman in labor got out of control and kicked me in the head, and my head hit a concrete wall behind me. And there was a huge cracking sound. I was sick. I had a headache. Some witnesses testified that I actually passed out. I can't remember. I don't remember a whole lot of anything until I was in the emergency room.
So then you filed this workers' comp complaint, and what happened? What did Adventist do?
Well, basically I filed the work comp claim, and I wasn't getting any better within the next couple days, and I had these teeth missing. So the one lady, the health nurse at the hospital, told me to go to a dentist and get this looked at and have my teeth fixed. And so I did that. I went to a dentist that I found and had it looked at within like 2 days. And he wrote a report, and at that point, initially, the claims adjuster that was contacted, she wanted it to be billed to my private health insurance from work. And I refused to do that because it had nothing to do with my private health insurance. And there was a large sum of that I ended up paying out of pocket because I had to get these teeth done. And so this dentist put in he had to extract some teeth, and he put in a temporary bridge, and that temporary bridge is still now in my jaw. it hasn't been repaired or fixed or anything yet. And then as time went on, I ended up having more and more problems, and my dentist was trying to get me to see specialists, and it just wasn't working out. And then when the insurance company sent me to a doctor by July that year, that doctor agreed with the dentist, but basically said I should just put heat on my cheek and eat soft food. It turned out a couple years later that I actually had an internal derangement of the left TMJ, which needed surgery. That surgery was performed over 4 years after the date of injury. I continued working. I tried to get disability, and they said that I couldn't get disability. I ended up getting an attorney. Until that point, I had never been in an attorney's office. I was always under the assumption that if you get hurt on the job, your employer will take care of it and you can go back to work. And I was just wrong, and it was a really hard lesson to learn, because you want to be a good employee and you want to do the right thing, and basically you're railroaded from the word get-go. And I actually continued. I would beg the supervisor, I would beg the claims adjuster, please put me out of this, get me to a doctor, treat me, anything I could think of at the time. And then finally I broke down and I did get an attorney. And this attorney, without even attempting to send me to a doctor or anything, came to me and said, I can write you a check for $9,000 right now and you can go away. And I looked at him in complete disbelief, because I was like, I just want to get fixed. I want to be able to return back to work and get fixed and made whole. And from then on, it just got worse and worse. And what really, I believe, catapulted it was that a couple months after this, there was an incident at the hospital where a physician showed up for a C-section, and he was completely incapable of doing the surgery. And I ended up having to call the administrator at like 1 o'clock in the morning. And he basically said to me, he said, well, just get another doctor in there and just kind of watch him. Just keep an eye on him. And I felt really, really uncomfortable doing that. And I ended up calling a different physician, who then performed the surgery. And I had to write it up as an incident. And from then on, it was just a matter of, how dare you turn in this doctor? How dare you do this? I was threatened. My personnel file was just absolutely destroyed. And
how did they destroy it?
They basically, years later, when I was able to subpoena the personnel file and take a look at it, on the same day that I turned in the doctor, they had actually written me up saying that I was too stressed out and I couldn't do a job, and they were giving me a warning, and that I was picking fights with other employees. And these were all accusations. I don't know the exact wording of them anymore, but these were all accusations made against me. And never once did I sign anything, did I read any of these things. And the interesting thing about it, everything started the same day as when I turned in this physician. And it's dated the same day as my incident report. And there's no way they could have reprimanded me, because I turned in the incident report at 7 o'clock in the morning when I left my night shift. And I went home and went to sleep and was at home and didn't work the next 2 days. And these reprimands are all dated that same day that I had turned in that physician. And my signature is on none of them. And it's just hard to go and prove and say you didn't do any of these things, and then you don't know about this for years, and there are statute of limitations. And so that's kind of how it all started. And then I never got treatment, and eventually they called me in January of 1997. They called me and said, you're just too stressed out, you can't handle this job, you need to quit this job. And I was like, are you firing me? And my supervisor at the time told me, she says, no, I'm not firing you, I'm telling you to quit. And by that time, this is now 3 years after my injury, by then I was in such excruciating pain. I had all these medical problems, and I just gave them my resignation and I quit. But I still had a work comp claim, and I had filed the work comp claim with the WCAB, and it just was one railroad action after another. I'd go to a doctor, or I'd try to get to a doctor, and it would be denied, and then they'd send me to a doctor again, and I'd see one doctor after another, but I still wasn't getting treatment. And finally, in 2000, I was in 1990, I believe it was in 1998, 1999, I did find representation, and there was an award and order done. And the award and order was for basically uncapitated medical care pertaining to the certain injured body parts. And at that point, when the judge made the award, I was told to get my medical care, that there wouldn't be a problem. I was really excited. I thought, well, finally now I can get medical care. I immediately sought out doctors to go see. I went to see a neurologist. I went to an orthopedic rheumatologist, excuse me, and I saw a dental trauma specialist for what was going on. All three doctors, the rheumatologist, the neurosurgeon, and the dental trauma specialist, declared me completely temporarily disabled and that I needed all this treatment. So when I went back to court to see if I could get temporary disability and get that reinstated, the defense attorney that was representing my employer was no longer the defense attorney, and they informed me that there was now going to be a new attorney, and they didn't know what his name was. So I continued getting my medical care, which of course now was all done on liens. And in January of 2001, they had gotten a new defense attorney. His name was Mr. Dennis Hirschway. And I had one attorney actually tell me to be really careful, that this attorney was actually a very mean and vicious person. And I thought, well, it can't be that bad, because I have an award and I'm going to get treatment and I'll get better and I can go back to work. The first thing the new defense attorney did was he wrote letters to all my doctors, informing them that if they continued to treat me, they did it on their own accord, because in fact I had never gotten an award from the WCAB. So he would write to the neurosurgeon that I had no award for a neck injury, which is untrue. He wrote to the dental trauma center doctor and told him that I had no award for my missing teeth, which is untrue. And he went around to all the doctors and basically told them to stop treating me. And luckily enough, they did not stop treating me.
Isn't that fraud?
After I started looking into it and I started representing myself and trying to figure out this whole mess, I finally realized that it was fraud. It was fraud, and worse than fraud, it was actually really terrible violations, because they were putting this in writing, and they were actually in writing telling the doctor something that wasn't even true. And at one point, the defense attorney wrote a letter to the judge that issued the award and told the judge that she never issued the award and that I was a liar and unbelievable. And so when I presented this to the judge, it was the judge that sent me to the district attorney's office for investigation of insurance fraud. And that's when that was around 2001. And that was the first time I ever went to the district attorney's office and presented this issue of this fraud.
And which district attorney?
That was the district attorney's office in Kern County in Bakersfield. And I went in there completely naive, thinking that, well, I'm doing the right thing. I'm taking this to the district attorney's office and they'll take care of this and I'll get my treatment. And when I presented everything to the district attorney's office, that time, the first time, the investigator actually came to my house. He looked at all the evidence and he agreed with me that it was all wrong. But then he said, well, it isn't that bad. They haven't hurt you yet. And I said, well, how bad does it have to get? Do I have to die first, or do they have to physically hurt me before you do something? And so that investigation kind of went to the wayside. But I did not, I decided at that point that I was going to continue trying to do the right thing. My ultimate goal was to get treatment for my injuries. And finally, by September of 1997, my dentist actually told me, he said, you can't work anymore. You've got to quit working. And this was in 1997. So by 2001, I was now receiving Social Security disability, finally. And before that, I had been getting some state disability, which ceased. And
isn't that fraud? I mean, you're actually getting Social Security disability when your injury is a result of...
Yes, I was examined by a Social Security doctor. They looked at all the records, and one of the issues that came up was that I still had this, after my jaw surgery in I believe it was 1998, I did have jaw surgery, which alleviated a lot of the problems, but I still had problems with my neck. And the neurosurgeon, he was convinced that there was an issue with my neck. And even before that, when I saw a physical therapist in around, I believe, 1997, 1996, maybe even before that, he was even convinced that this was a whiplash injury that had happened, and it was the same as if someone had been in a car wreck, and that the symptoms I showed were symptomatic that there was some kind of a neck injury, except the problem was I couldn't get to a doctor to get a proper diagnosis done. Now, in 1997, there was an incident where I was in such bad shape that just to get medical care, I went back to San Joaquin Hospital to their emergency room. And I presented myself there early in the morning with complaints of my arms going numb. I couldn't see out of my left eye, and I had this terrible neck pain. And the emergency room doctor saw me, and they wanted to do various tests. But then, of course, I was flagged as being this person with this work injury. So I actually spent over 9 hours in the emergency room. So I sat in the hallway for 9 hours in excruciating pain. And they ended up doing an x-ray. I believe it was an x-ray or CT scan. And the interesting thing was, the emergency room doctor came to me and said that there was something going on, except that he felt I needed an MRI. And so he had actually called the claims adjuster by 4 o'clock that afternoon and had told the claims adjuster that I would need an MRI. And the claims adjuster said, no, she can't have an MRI. She should go back to the AME in Fresno. So the emergency room doctor actually called the AME in Fresno, who was a dentist, and said, look, can you please approve an MRI so we can send her for an MRI? And he agreed. He said, have an MRI and see what's going on. And they wouldn't do it. They made me drive all the way to Fresno to see a doctor to say, yes, she needs an MRI. And then I still couldn't get the MRI. Years later, I don't know exactly when it was, I found out that on that day in 1997, there were actually 2 medical reports issued. One of them was, and I don't have the records with me right now, very specifically on the times, but they actually had 2 reports, and one of the reports said that there was evidence of compression fractures in my neck, and the other one said that there was nothing wrong with me. The interesting thing about these records when I started looking at them was that the one that said they were dated the same date, but the times were different. And normally in medicine, you start out with the least invasive diagnostic study first. So you would first do an X-ray, and then you would do a CAT scan. Well, in this instance, the CAT scan was dated and timed first, and then the apparent X-ray was dated and timed second. So and I don't exactly remember which one said what, but the diagnostic study that said there was evidence of compression fracture to my neck, that document was gone. And I accidentally happened to get it when I had to pick up some records at the hospital, and I was going through these records, and this scan fell out on the floor. And I looked at the scan, and I'm reading evidence of compression fracture, and I'm going like, oh my, this is like years later, and I'm going, oh my God, they knew I had a compression fracture in 1997, but didn't do anything about it. They just showed everyone the report that said there was nothing wrong, there was no evidence. So I was so distraught. I actually went to the Department of Health and Human Services, and I begged them to investigate the situation. And I believe it took nearly 2 years. And finally, the Department of Health and Human Services went unannounced to the hospital and went through the records and actually came back with a written report for me that said, first of all, the X-rays are gone. The CT scan is gone. There was, upon Department of Health and Human Services investigation, there was only an empty envelope in the radiology department, and the reports were gone. And it was noted upon their investigation, Department of Health and Human Services investigation, it was noted that a physician had come into the radiology department and checked out all the records and never returned them. So someone from the hospital went there and destroyed the records, and that was the end of it. The records were gone.
Now, you also began to experience harassment, and you had a situation where they were after you. How did that happen, and hooking up with Larry Nine, and that you were not alone, you were being harassed, and you faced this kind of
and I learned this the hard way. For the longest time, I always thought it was only me that was going through this, because I really had no connection to other injured workers. And in 2001, I actually filed a civil suit for racketeering in the civil arena, and I ended up being represented by a law firm on that part. But through this, I met other injured workers, and I met Larry Nine, and I met Christine Peets, and that's how I met Steve Zeltzer. And I finally saw and understood that this constant harassment of injured workers, bullying them, chasing them down the road, putting investigators on them, that was what insurance companies did. And I was appalled, because I didn't think that my injury would be that difficult to fix. And the doctors even testified to that if they had treated me quickly, efficiently, I would have maybe been off work for maybe 6 weeks, and I could have returned back to my normal capacity of work, and I could have maintained my financial integrity, and my children wouldn't have gone through the horrible things they had to endure, and my family. And so once I realized that it wasn't only me, it didn't become easier, but I started to understand that this was going to be an uphill battle.
And what exactly did they do to you to harass you beyond just...
There were a couple instances, and first of all, the harassment at work. The harassment at work, I was accused of being racial discrimination against other ethnic groups of nurses. I was accused of yelling at people. I was accused of being belligerent to patients. I was accused of bad nursing care. And I was appalled at this. I was absolutely shocked. And they would produce statements, anonymous statements, that were signed by no one, that would say, well, we have a grievance, she's doing this, and there never was any proof. There never was any proof that I did any of this. And then in 2000, I believe around 2002, I believe it is when it started, 2002 or 2003. I didn't even find out about this for 4 years. They actually put an investigator on me, and during a deposition, it turned out that there was 4 years worth of Sabrosa videotaping of me. So they followed me around at all hours of the day. At one point, there was an incident which was really, really scary, was the investigator was chasing me down a road, and I was in real fear for my life. I thought he was going to run me off the road. And at one point, even after court, I was in court, and I was on my way home from court, and Larry Nine was in the car along with another gentleman, and we were being chased down Highway 58 by an investigator at speeds of anywhere from 80 to 90 miles an hour. And it was only that we figured out that the person was specifically chasing us that we were able to get away, because I strongly believed he would have chased us to cause us an accident.
And the Adventist also said that you had threatened their employees?
That was another one of those that came much later, when the laws over the 18 years of my case, the laws in the state of California have changed at the blink of an eye every time it's a new law.
Well, why don't you talk about, like, you decided that you were going to go after them legally. And why don't you talk about that experience?
So what I did is I finally decided that I was going to have to go after them about what they were doing. So one of the things was I was in desperate need for a spinal surgery, and there was there is a law about the utilization review procedure regarding request for authorization for spinal surgery. And I had followed all the rules, but the claims adjuster, instead of following the rules for the second spinal surgery opinion procedure, the defense attorney wrote a letter threatening my doctor, first off, and then the claims adjuster wrote a letter to my doctor and said, would it be okay if she could have an epidural spinal injection in lieu of spinal surgery? So they were well aware of the fact that I needed spinal surgery, but were willing to give me a pain shot instead of spinal surgery. So what I did is, I knew they had missed the deadline, so I took the letter, I wrote a letter to the head of the Adventist Health System. And I pleaded with him, after double checking with the state that I was right. I told them, I said they had missed the deadline, and according to the law, they should approve the spinal surgery, and please give the approval for the spinal surgery so I could have the necessary surgery. And right after, 10 days after I sent that letter, I was asked to testify in front of the Fraud Commission in Sacramento. And as I was going in to testify in front of the Fraud Commission, the defendant served me with 8 restraining orders. I was completely shocked. I was given 8 restraining orders, and I never in my life, I never even thought, why would, I always believed a restraining order is for a criminal, and a restraining order is for someone who does something horrible, like a husband beating his wife or something like that. And here I was standing in front of the Fraud Commission, and I had 8 of these restraining orders in my hand. And of course, I had to answer the 8 restraining orders. So in order to answer 8 restraining orders, I had to do 8 separate cases. So in the state of California, if you have 11 cases in the court system, I believe it's 10 or 11, you can be declared a vexatious litigant, meaning you are barred from litigating without an attorney. And I didn't know this, but I think it was well planned out by the defendants, because 1 restraining order would have been perfectly fine. 8 were unnecessary. When I actually went to court in Placer County to find out what I had done to justify 8 restraining orders, the defense attorney, along with one of the restraining order holders, were in the courtroom, and I asked the judge what I had done, and the defense attorney said that I had been writing complaint letters to the federal government, which is true, and therefore they needed a workplace violence restraining order on me. I had not worked for this company for years, but the judge granted the restraining orders.
And were there any witnesses?
There were plenty of witnesses there. Larry Nine was there.
From their side, saying that you'd done these...
No, the only person from all the 8 people that filed the restraining orders against me, the only person that was in the courtroom was Mr. Chuck Pearson, who is one of the restraining order holders. And he didn't say a word. He didn't say anything. It was their defense attorney who said that I had been writing complaint letters to the federal government, and the restraining orders were granted. I appealed it. I took it to the federal court, and I was then declared a vexatious litigant. Further smearing my reputation. What was interesting on the whole issue was, in 2008, I finally was going to trial on my civil racketeering case I had filed against the defendants. And during this trial, my attorney questioned three of the restraining order holders that were witnesses in this trial. So the first person was Bob Carman, who's the CEO of the Adventist Health System, and they questioned him if I had ever threatened him, and he said no. They asked him if he knew me, and he said he did know me because I had told him at one time about my work comp injury, but he had never seen me. And so they asked him why he got a workplace violence restraining order, and he said because the other people told him to get one. And when they questioned the claims adjuster, Carol Pope, why she had gotten a restraining order against me, she didn't, I don't recall exactly her reasoning, but when Mr. Chuck Pearson was questioned why had he gotten a restraining order against me, he testified under oath that I had written death threat letters to all his employees and to his family, and that he was in fear for his employees and his family, and therefore, because he had apparent death threat letters, he got a restraining order against me. He then also went on to testify under oath that he had a psychiatric report that apparently was issued, and the psychiatrist who apparently issued this report had deemed me a dangerous person. And Mr. Chuck Pearson had read this report, and based on the diagnosis that was given, he felt that I was a danger. And from 2008 until this day, I have been trying to obtain that psychiatric report and the death threat letters because they don't exist. The defendants have not been able to produce them. And Carol Pope also testified that utilization review had actually denied me spinal surgery, and that issue was cleared up approximately a year and a half ago. The defendants were unable to produce a utilization review denial regarding the necessity for me to have spinal surgery. So that shows me that on multiple accounts, they have lied under penalty of perjury before a sworn jury and have no evidence to justify any of their actions against me.
Now, why don't you talk about, you also filed a Ku Klux Klan suit?
I had filed a racketeering case, and then I had filed another case in the federal arena for their harassment against me and the way they were treating me, and all these cases were thrown out after I was deemed a vexatious litigant.
And they tried to get you categorized as a mentally incompetent, so you
Yes.
could not...
They at one point, they tried to deem me mentally incompetent, and they actually did, they did appoint a guardian ad litem at one point, and then that was removed again. And basically, the whole time, I was just telling the court I need spinal surgery. And finally, in July of 2006, my spinal surgeon, on an emergency basis, performed the spinal surgery. And at that time, it was covered by Medicare. And after the spinal surgery, I had great success. The spinal surgery was actually really good success. And I felt much better. And I went back and have been trying to get the court system to order the defendants to repay the federal Medicare program. I've gotten it to the point where they, now in court, are held responsible for the spinal injury and are responsible for the surgery, but I can't get anyone to order them to repay the federal Medicare program. And this cost shifting, people are put in such dire need for health care that they go to Medicare, and Medicare covers it, but when you try to get the money back for Medicare, no one helps you. And the costs are astronomical.
And then you discovered that another person contacted you.
Yes. I was contacted approximately, I believe about 2 or 3 years ago, probably around 2 years ago. I was contacted by Steve Zeltzer, and Steve said that there is a lady named Patricia Molesky who really wanted to talk to me, and that she had worked for the Adventist Health System, actually in their IT department, I believe that's what you call it, and she had been trying to get a hold of me. So, but she was in Florida, over on the East Coast. So I thought about it for a couple days, and I actually called her up, and it was like we had known each other forever. I talked to her, and you have to be really careful when someone calls you and tells you these things, because you don't know if it's someone from the Adventist that's calling you and giving you a big sob story. That's happened too, and you feel empathy. You feel sympathy for them, and you want to help them, and then it turns out that they accuse you of all kinds of things. So I listened to her story, and I listened to what she had to tell me, and it was like she was repeating my story. She was talking about records deletions. She was talking about being threatened, how her car was set on fire, how she had gone to the FBI, and I could totally understand her because I had gone to the FBI too. And I also had brought the information to the FBI. And I was also threatened. And I know for fact that my medical records have been tampered with. And so I was even more in shock to hear her part. And then what shocked me the most is when she was explaining how certain work comp records are changed to different kind of incidents, I believe. I'm not an IT person, so I'm just kind of explaining it how I understand it, so it doesn't look like work comp incidences. And I can totally understand that too, because the day of my injury, when I went to the emergency room, the night of my injury, and all subsequent times I had to present to myself to the injury, for the injury to the emergency room, the records clearly state that I'm presenting myself with a workers' comp injury that happened in the hospital. And so it's on the record. But what the hospital did, they didn't cover the costs. Instead, they sent them to collections for me to pay. And I couldn't pay these emergency room bills. And so they were in collections, and of course they ruined my credit. And that's one of the things that they do. They ruin your credit, ruin your credibility, make you out to be a lunatic, and hope you go away. And one physician put it very clearly to me. He said, "You know, Barbara," he said, "they delay and delay to hope you go away. And then they'll deny and deny and hope you die." And that's exactly what these people do. And they don't do it to one person, they do it to everyone.
And you went to the federal government, you went to all the government agencies?
I wrote, when they put the restraining orders on me and said that I was writing complaint letters to the federal government, that is true. I probably sent hundreds of letters to every congressman, every senator, to the president, to my representatives, to everyone I could think of that could possibly help me. And they all got the letters because I would then send them letters under the Freedom of Information Act and say, I want to know what kind of letters you've gotten from me. And they would send me boxes back with photocopies of all my letters I sent them, stamped on each letter that they received it. But not one time, not once, did anyone ever step in and help or answer my concern.
Okay,
So I'd like to go back to all these letters I had written. Actually, what happened, and I'll go back to the year 2000, I was told by the judge to apply for Social Security. And I was naive and I didn't know how to go about it, but I was pretty desperate. My house was now in foreclosure and my entire savings had been depleted and my college fund for my kids had been depleted. And so I went down to the Social Security office and I filled out all the paperwork and I was denied 2 times. And then I was so desperate that I actually found out that Senator Feinstein, Dianne Feinstein, was in charge of these Social Security issues. So I called her office and I pleaded with the person on the phone. I said, I am in dire need. I gave her a rundown of what was going on. And I said, I really need to get this Social Security taken care of. And I told the lady, I said, I have 3 minor children. I am out of money. I had gone down to the welfare office and I couldn't get food stamps and I just needed some help. And so she said, okay, she will let Dianne Feinstein know. And I was so desperate. I didn't know what to do anymore. And in the evening, that evening, probably around 7 or 8 o'clock, I got a phone call. And it was Dianne Feinstein. And Dianne Feinstein she said, Barbara, I heard about your issue and I'm so sorry, but I'm right now in the hospital. My daughter is having her baby. And I said, oh, I'm really sorry that I'm bothering you. And she said, no. She said, I'm going to make a phone call and we're going to get a Social Security judge down to Bakersfield and we're going to get this taken care of. And she did. A Social Security judge came down to Bakersfield specifically to have a hearing on my case. And I pled my case to the Social Security judge and my Social Security was approved. And the judge was appalled at how many medications they had put me on, in that the insurance company wasn't taking care of this. And so I got my Social Security, and he told me it would take a couple days till I got his opinion. I had his opinion the next day, and I went down to the Social Security officer in Bakersfield, and he looked at all the paperwork, and he said, it's going to take us a couple days till we get your checks instated so you can get some money. And I just sat there and I was crying, and he said, what's the problem? I said, I really need some money for food right now. I have 3 kids at home. I said, and we really need some money for food. And he went ahead and he handed me some cash and he said, we'll get your check started, but go home and buy dinner for those kids. And I went home and I was so excited because I could put food on the table that day. And I just never in my life believed that you could be put into such hardship over the fact that you were hurt at work and your insurance company, that's a hospital system, that's the largest hospital system in the United States, can't treat you and fix you and get you back to work. And so I really have to commend Senator Feinstein at that time on helping me. But all other pleas for help, all other evidence I've submitted, nothing, no one pays any attention.
Well, this fraud, I mean, the fact that they're forcing the federal government to pay for basically their liabilities. These politicians know about this.
They do know about it because it is an issue that comes up, and Medicare and Medi-Cal fraud is a big issue, but they don't seem to be addressing it when it comes to workers' comp. I think there are injured workers should be taken care of by their employer or their employer's insurance company. I'm grateful that Medicare paid for my spinal surgery because it saved my life. But do I believe that they should be reimbursed? I do. And I went to court, and I have a court order that says the spinal surgery is the liability of the insurance company. And so I believe the insurance company, even on their own fruition and good faith, should pay back the federal Medicare program. I don't think they should be allowed to just ignore it. This is cost shifting, and with this new law coming out, I strongly believe it's going to become an even bigger burden on the federal government and on local institutions versus the insurance companies that should be paying for this.
Is Adventist health care above the law? Well, what do you think about Adventist health care?
I went to work for the Adventist Health System because when they asked me to join their team, I actually talked to my mother about it before I took the position. And my parents had spent 30 years in Africa, and my mother had good experiences with the Adventist Church in Africa. And she said to me, well, they have been good. I think it's a good choice to go work for them and help them out. And so I left a very good position to go work at San Joaquin Hospital, hoping I could make a difference, until I realized that I believe the Adventist Health System thinks they're above the law. And I was angry for a very long time. Anything that had Adventist on it, I have to admit, I became very, very angry. But I have learned over time that it's the higher echelon of the organization. It's the CEOs that get the $2.3 million bonuses. It's their hierarchy in wherever they are that makes these decisions. I do not believe it's the churchgoers. I don't believe it's the people that give their money as tithings to the church. I think overall they are good people and they want to do the right thing. But I believe it's turned into a business and it's all about money. And I actually spoke one time to a gentleman who was the chief auditor for the Adventist Health System, one of their auditors, and he fell under the same wrath as I did for realizing that they were not doing right on their books, that they were fraudulently shuffling money around, and he actually wrote a book about his troubles, and he was ousted. and he was harassed, and he was accused of doing things, god-awful things, that this poor gentleman never did in his life. I actually one time sent him copies of the income tax returns that I had obtained from the Adventist, and I asked him, I said, can you look at these income tax returns and tell me what you see? And he showed me how the money shuffled around and how loans are given out to who knows who, and bonuses and country club memberships. And
so you weren't surprised about what happened to Patricia Molesky?
Absolutely not. Absolutely not. I have since then talked with her a lot. We speak a lot.
What did you think of Patricia Molesky?
I think it's god awful what they've done to her. I think it's sad that a person who wants to do the right thing and help a company out gets treated this way, gets harassed, gets bullied. Your life is destroyed. Your life is absolutely destroyed. And I think it's appalling. And I think what she's gone through is horrible. It's horrible. I don't even know in words how to explain it. I do know that she's right. I do know that they do falsify these documents. And
this electronification, what does this mean for the public and workers in the industry, and injured workers?
I think where the problem comes in with the electronic medical records, if it is done right and has security aspects built in, and I'm by no means a computer person, but I think if there is security built in and that these medical records are safe from tampering, overall I think it is a good idea. The problem I see is that there is no security built in because, like Patricia said, they just delete the records. And once those electronic medical records are deleted, they're gone. So as long as you have hard copies of your medical records, then you can show discrepancies. But what happens if nothing's wrong with someone, and suddenly they tamper with the medical records and say the person has this or this diagnosis? And then if that person should show up in a hospital with something totally unrelated, and it shows up that they have this diagnosis, they're going to get mistreated and people are going to die. And I think there has to be oversight. I think there has to be a security system built in that prevents hospitals like the Adventist Health System from being able to tamper with these records. Because I think it's detrimental. I think it's a way, who knows what could be done with it. There's hundreds of things that can be done with. You just cannot tamper with medical records. And I've seen it, for the longest time I always thought, no, there's no way this can be done. But I know various cases now where doctors will put in diagnoses for patients so that they can bilk the system, but that patient really doesn't have that disease. And they go to another doctor and the doctor tells them, oh, by the way, you have this disease. And they say, no, I don't. And it's right there on their medical record because some doctor is bilking the Medicare program and coming up with these diagnoses, which it's horrific. It's horrific. And until a person personally faces that, there has to be oversight. Someone has to watch out over this stuff.
Why don't you talk about working with other IWNN, Injured Workers National Network, why you've decided to work and build a movement of injured workers?
The biggest reason I got involved is because I feel that I can contribute something. And I believe it's such a big problem that people have to get together and work together for a common goal. And I think it's a lot of people, the more people that get involved, everyone brings something to the table. And I think if we can take all that knowledge that's brought to the table and have a movement to where change can be made, I think it's a good thing, and I think it's a worthwhile cause. And it always brings me back to, I believe it was Kennedy who did the speech, don't look what your country can do for you, what can you do for your country? And I think everyone should take that to heart. And I think by being involved and speaking up about this, that's what I can do to hopefully better the system. It's going to have to be lots of people working together. And at some point, I do hope that the federal government gets involved. And I really hope that senators and congressmen take this up as a real serious issue, because it's just, if you don't take the bull by the horns now, it's going to be a problem where even at this point the Adventist Health System rates themselves as being the largest healthcare organization in America. That's a monopoly. And people aren't going to have a chance.